Happy Thursday, everybody.
It's what, November 7th?
Yes, 2 days after the E word. Still cautious on saying stuff just because I don't want to get flagged. Dan just got back from Tampa, decided to travel during a critical week.
I didn't think about it very well. I should have been more conscientious of it, but it was fine. Like, it is probably a good rule of thumb to not travel during the week of a big E event, but I've been putting off travel for 3 or 4 months because of football season with all my kids. I was just glad an EMP didn't go off or something and your plane fall out of the sky or something like that. So I know, I should have been leery. But yeah, I was in Florida, visited the troops there, our staff, our other office there. Like I said, we probably don't give it enough attention, but they're doing great down there. Selling, doing very well.
Recovering from a hurricane, multiple hurricanes.
Yep, and agents are doing really great. Leadership is great there. They're on track, so that was a good, just quick visit there for a few days. It's been a busy week.
Let's get into it. We wanted to first talk about some of the kind of updates and early kickoff impressions on OE, open enrollment, on the ACA side of things.
Yep.
So
let's do that. A couple things. We announced it last week on our episode of the podcast where we were, somewhat critical of Oscar, and we understand like the economics of Health Sherpa and the cost there. Certainly, we like the modeling to where the carrier has to incur the cost of the enrollments. Like we prefer that, and it is expensive for carriers to do that. But Health Sherpa has kind of won out as like the marquee enrollment platform in the ACA or the marketplace space. And so, we announced that we thought that was a mistake and that it would hurt their enrollments. And then it sounds like just this week, they announced that they are back on Health Sherpa.
Yep, so, back on Health Sherpa.
So that's some news for everybody.
Yeah, some also critical updates. Health Sherpa has had the new, worked with CMS to get the new approval tool for any agent of record changes, or actually just updates the plan called Resume Link.
Yep.
And, our early feedback on that is it is not functioning very well.
It's not working. It's almost bad enough to where we don't even try it as a mechanism to do enrollments. To be honest.
Anecdotally, it's 10% it's working, and it's just a huge pain in the butt. And I do not blame Health Sherpa for that in any way, shape, or form. They're just trying to follow the CMS rules and guidelines to make that tool useful. But maybe somebody on the technical side of Health Sherpa could explain it a little bit better.
Well, I can explain a little bit. Part of it is it's trying to match consumer data, kind of like if you've ever been on websites and it's trying.
Experian.
Yeah, it runs through Experian. So from credit reporting, number one, if anybody's ever froze their credit, it doesn't work because you have a credit freeze. So
or you don't have credit, which a lot of people are young or don't match.
So there's no credit, or if you've frozen your credit, or people who have had actual fraud, it creates a total issue on their file with their credit file. So again, the mismatches of information when it's asking people to verify certain pieces of information, like, did you ever own property here or there?
We were joking about that before because I've had those questions before where I'm legitimately trying to get a loan or verify my identity through those things and I fail it and I'm like, what the hell? How do I not know the answers?
It was 13 years ago. I kind of forgot. Yeah.
I'm like, what year did I buy what year Volkswagen and how much was my payment? Like, I don't freaking know.
Well, first of all, you bought a Volkswagen, so that's a problem.
Yes, that's why it stuck out to me because it wasn't. Hey, I rebought a new, nicer version of a Volkswagen called an Audi and doubly learned that lesson. So
and a Range Rover.
Yep.
Triple lesson. But hey.
But I also got the new Freedom Mobile.
That's true. But hey, so going back to it, that's what's not working on the link. It's an attempt to, but that's what's going wrong. And so ultimately for like our internal practices within like our direct to consumer, like our call center and in our coachings to our field agents and distribution, we're just kind of working around saying, hey, it was a great effort with the Resume link. It's not really that viable. Just doesn't seem to work that much. So inevitably we're having to do the 3-way call to CMS to the marketplace to perform those enrollments. And word is at this stage of the game that the wait times are about 10 to 15 minutes to
sometimes
complete.
20, yeah.
Yeah, but the average time is about 10 to 15 minutes to do an enrollment, which isn't brutal, but it's certainly not like a 1 or 2 minute, wait where you connect to somebody and get it done. So
do you ever think, what year is this? We have hold times for 3-way calls calling into CMS, and we have Medicare carriers trying to force us to go back to paper apps in certain circumstances. I'm pretty sure we're going into 2025. Nevertheless, we're being forced to go back to all these antiquated business practices.
Back to the future. No,
Yep.
I'm just kidding. So I agree with that. And the other thing that we have that's come from that too is that the fraud is way down. So I will say that while I'm acknowledging that it's not a very great process to be calling in and doing a three-way call, at least most of the fraud has been curbed, it seems like. If you're running a business though, and you are, doing a P&L and time is money, and you think about every call and interaction and having to call in and wait 15 minutes on a call, or if you're a field broker, I mean, nobody really wants to even be doing that. Even if you're at Mr. Jones's house and, they're ready and you go through, a whole needs analysis process and you find a great plan for them. And then every single sale you're, sitting on the phone 15 minutes, it's not very scalable. It's not a great solution. So we're still hoping for more iterations, more technology improvements. But that's kind of where it's at right now. Should we talk about the fraud part?
Yeah, I was
too?
just going to say, we're hearing a little bit of reports from some of these bad actors that are having somebody else in their own call center act or portray that they're the member because they have the information and they're doing it. Those calls are recorded by CMS.
So
you're going to get popped for actual real fraud. You better not be doing that.
So for regulators listening to this, for anybody within the government, because we do know that people at HHS and CMS listen to this podcast, carriers, one of the things we have heard, to Mike's point, to expand a little bit is, the three-way is supposed to be between the agent, the member, and CMS. And so what they're doing is within the same call center, this soft phone number is calling another soft phone number, like another department. And if it's a male or a female consumer, it's just a male or a female agent within the call center getting on and being like, yeah, this is so-and-so. Yeah, I want to change my plan.
Let me verify that date of birth and social.
Yeah, here's my social. Here's my date of birth. Yep. And then they change their plan, and it's not really the consumer. And so it's like, that's a freaking recorded call that the government is recording at Marketplace, and they're going to have you on a recording actually committing fraud with a recording.
Yeah,
so,
I think the actual amount of people that are doing fraud are very, very far and few between on the Medicare and the ACA side, but they do it rampantly, wide scale, and they want to scale it and do it fast. And we and anybody that's participating in that are going to turn you in, because all these small little groups of people that are being bad actors are causing a lot of chaos for the 99.9% of people who are doing it the right way, the trustworthy way, and we're just tired of it. We're tired of everybody being labeled fraudsters and scammers and problem when it's really only a micro percentage of the actual industry out there.
Yeah, agreed. I just wish it would be like, even when I log into any of my banks, right? Like now I have my cell phone registered with any of my financial institutions. And of course, even when you know the password or whatever to log in, you get your 2FA, like you get your text, authentication. Like, let's just have that be the thing. Let's just get this done. And let's move forward with technology like that, where the consumer gets their 2FA. And if they can't verify the 6-digit code, you can't do the enrollment. It'd be pretty easy. But anyways, my two thoughts, but that's just early reports on the ACA. But just remember, we did a big ACA kickoff. It's overall for 2025. We still have the enhanced subsidies. The marketplace seems pretty stable. Premiums, overall benefit package and offerings look pretty good overall. Minor disruptions in the marketplace or the ACA side. Really competitive pay for the carriers, good bonuses, retention incentives in place. And so I would say overall, the ACA or the marketplace looks fairly good, a lot less chaos than the Medicare side.
It's definitely better than it was in January, February of this year. Right now, we'll take it how it is now.
Last year.
But last year we thought it was all gangbusters, but it was a fugazi, right? It was all sand through the hands. Because everybody yelled.
It was a CF.
Yeah, it was very, very, very bad. We also have a lot of our entity, our agency. We have a lot of really good ACA agents, and we've worked really hard over the last 2 years to build a very robust ACA downline. And a lot of our partners I feel like they're some of the best ACA agencies in the country. We have a lot of good.
Yeah. We always find it weird when we have to go preliminary screenings with carriers on the marketplace or ACA side when they're like, "Hey, what are you doing to prevent what they call them, like UPS, unauthorized plan switching or unauthorized, and we're like, we've never allowed this crap. What are you talking about? Like we have really strict and rigorous compliance things in place. We record all of our calls anyway, and that's one thing to mention is, in case people didn't hear this on our kickoff, they did announce that call recording is going to be mandatory in 2026 for ACA or for marketplace. So keep that in mind. But anyways, we've always recorded every single interaction with everything. We've always gotten consent and permission, and we always have, we've always been able to do that. So I don't even know what all you're talking about with unauthorized agent of record moving or unauthorized plan switching. You know what I mean? So we've always found that to be weird that that's even a thing. But
yeah, so we're definitely bullish still on ACA, even despite that we think the changes is we're still bullish on ACA for sure.
Yeah, and remember, Georgia went to private exchange this year too. They are going to be, but still, you do your certifications through, and you can still write apps through Health Sherpa. So that's the one thing we like, even though it's private. You can still write the apps through Health Sherpa, which makes it a little bit easier. And then I would say, just from like an outlook looking forward, because of financial reasons and economics, I think that you're going to see more states going off of the FFM and doing private exchanges. Our hope is if we see more of those with Health Sherpa, kind of like Georgia did, that at least it makes it easy to do business there. And the reason I say that is because, let's say you write business in 8 states, you're using that to check your enrollment data, your renewals, your binder payments, all that information on your ACA cells. And if you have an outlier state that's not in that ecosystem, then it becomes hard to start navigating to every carrier's different portal and website to try to track a lot of that information and manage your business. So anyways, just kind of granular stuff talking about the ACA and the business and where it's at right now. But overall, I'm going to give it a good, 8 out of 10, in the ACA marketplace right now, the environment there.
I'd be a little bit less than that, maybe 7 out of 10, just because of how inconvenient it is right now, considering the technological tools that we should be able to have and still be secure. But, let's talk about
Medicare.
Not to keep beating it to death, but, Cigna came out on the heels of
changing to our Medicare caps.
Yeah.
Yep.
Saying that they have a whole slew, basically the majority of their PPOs across the country going non-commissionable. Surprise, surprise.
Yep. So if you didn't catch our prior episodes, we started off with
Aetna, Anthem
announcing a slew of plans that were non-commissionable, right?
Yeah, WellCare had a couple more go non-commissionable and very
suppressed.
Yeah.
So
suppressed,
remember, they did say, good luck, good friends. If you can find a way to write this business, you're going to get paid.
I'm just going to say to all carriers, forcing people to back to paper apps is just so silly. Like, it's so painful. Find some other way to do it.
And they're back there thinking to themselves, like, ha, it worked. It made it so hard.
Just make it suppressed and just tell people that they should probably not write it because that plan's in danger of getting SAR'd next year or something like that.
Right.
But making people go back to paper apps, it's made our life hell. Me having to track down PDFs of paper applications and trying to get them out to agents and agents scrambling. It makes FMOs look worse. It makes agents look worse. It's a worse experience for the beneficiary. And they're able to still see these things on CMS.gov and find
we talk about it too, and it's going to increase compliance issues and agents sitting on applications and not submitting them within the 48-hour time period that they're supposed to from when they receive it, based on calendar days, not business days. All that kind of stuff. We're back in, I feel like I'm back in 2012, going through all these, bullet points of what you can and can't do again.
Yeah, it's interesting, these words that enter the lexicon about certain things in business, where now we're talking about suppressed plans when nobody even would have even known what that was last year.
Well, and actually those 2% of plans that we'll write that are paper apps now take up as much work as 10x. I mean, there's more administration, there's more humans that need to be involved in the process, there's more inefficiency.
They're less secure, there's more potential for fraud, there's more,
Well, I had agents too contact me and be like, hey man, this is like the good old days, so I can fax my apps back into you and have you scrub them. And I'm like, nope, not taking those. Send them right to the carriers. You better get your shit right, and you better have all your T's crossed and your I's dotted, because I'm not staying up till 3 o'clock in the morning again and scrubbing apps like I used to 10 years ago.
Yeah, good job, insurance industry. We're the only ones keeping the fax industry alive anymore.
It seems like it. Right?
Yeah.
Healthcare and insurance. So
keeping my kids come in and they're like, "Oh, you have a fax machine like The Office, the TV show."
It's true. It's true.
They're amused by it.
Yeah. So now remember, you have your non-commissionable plans, and then you have your suppressed plans that are still commissionable, but they're suppressed. So it's a quest, for you out there to try to find a way to write it.
And you carriers out there, you all think of it in a vacuum, right? You're like, oh, it's just these plans in these areas, and it's not that big of a deal and whatever. But when you have brokers that have multiple carriers in multiple states and things like that, all of a sudden it becomes this shell game where you're trying to figure out what you can write and where and who and what's commissionable and what's not. And that just causes so much chaos.
Well, and here's the other element to think about with that too is, you can kind of start piecing together too where they're going to sunset more plans in 2026, and these plans that are available now but likely won't be, because even once we got one of our cameras that went down and died. But even when they suppress these plans to try to reduce the enrollment data, you still are going to be getting some number of applications, and even by the time they shut them down in November, there was still a healthy amount of enrollments in some of these plans. So I don't see them just flipping that switch. It might limit it, but some of those plans still might be done for, come 2026.
Yeah. I mean, overall, I think as there's just been monetarily issues across the board in Medicare and Advantage and things like that, everyone's kind of taken a haircut a little bit across the board. Carriers are making less money, hospital systems, et cetera, and I guess that's how we're being affected as well. But maybe things will be changing here in the future.
Yep. And we can talk about post E-word things that we think will be, happening in policies that we kind of forecast and project. Let's
just say election, because then we can figure out if we can actually talk about it now that it's already happened.
If we're still going to be blacklisted.
Yeah.
But yeah, the bigger thing is even if there's policy changes that are going to be fairly significant, it's still going to take time to implement. So that's not coming until 2026, 2027, 2028. I mean, you have that timeline where you can't steer a big moving ship, that quickly. And so even if you're aggressive with policy, it's going to take a while. So if you're planning on the day being saved already for next year, it's probably not likely, and there's going to be more pain and more turbulence before. And so
let's set the table there and just kind of address it, that we realize that there's a lot of people who are either fantastically happy about the results or very upset. And I think right now, for anybody, especially how it relates to this business and how we'll talk about it, I don't think makes any sense to get either too excited or too fearful about things one way or the other, because the reality is we just don't know how anything's going to shake out, right?
We know some things.
But what I would say is, if I definitely would not be freaking out one way or the other, right? You hear people talking about, oh my gosh, the ACA is going to go away. They're going to strip it. They're going to pull it back. Medicare is going to go away.
It's mostly rhetoric.
And a lot of those things are just completely false, completely not true, where nobody's worried about those things. But there are some things that we do know will happen.
Before we go there and really delve into that last half of the podcast, because we're going to be talking about that a lot. The other thought that I was just going to share with everybody listening, talking about Medicare Advantage specifically and Medicare and broker managers, is now that you're seeing these basically non-commissioned plans in all these areas, the suppressed plans, everything else, you kind of go, a lot of these companies too, we saw them cut and shed employees and have layoffs, most of them over these last 2 years. Like if you've been paying attention, just about every insurance company has had some pretty substantial layoffs. Mm-hmm. And again, I know of a lot of broker managers, directors, regional VPs, and you kind of go, okay, you're a broker manager in a marketplace with non-commissionable plans and suppressed plans. Who in the hell are you out there supporting? And what's your job function? Because you're a broker manager for brokers who can't sell your product or won't, or there's no ability to. And so it's like, if you haven't like done the math yet and figured it out, you're either like a dead man walking, like you don't have a job here in the next 30, 60, 90 days, or you're going to be reorged or something else like that. But I would also say, expect for a lot of these insurance companies too to be doing some reorg and realigning some of their leadership and their broker support and their resources, because that's a big cost. Employment and employee benefits is huge. The payroll expenses are huge for these companies. Mm-hmm. So I would also plan on more of that. And with that, also know that you also, if you're listening as an independent agent, need to become more resourceful. You need to become better at your craft. You need to become more independent, more autonomous, figure things out on your own. You can't just rely on your local broker manager to do everything for you. And so that's the heed. And then I also like it, like from my perspective, because we've always talked about it, I feel like we work really, really, really hard for our money and provide a lot of value to not only our insurance carrier partners and where we're at in the supply chain and the agents. I think we do an incredible job for those dollars that we earn. And I'm okay with it. And I think that as you look forward to this new environment with less resources at the insurance carrier, agents are going to have to get, again, more resourceful, better, but you're also going to have to align with an agency or an FMO who is going to provide you with more training, resource, and value, because the carriers are just not going to budget that in. Mm-hmm. So that's another thing that I just thought is important to kind of bring up and address.
Yeah, I mean, being a broker manager in 2024 has been a rough gig, right? Because I mean, you're
2023.
Yeah, you feel like your job's potentially always on the line, and we know of even some positions where people were going to take positions and they were pending to start, and then it's like, oh well, maybe that's a bad idea because apparently you don't even have plans, or you at least don't even have sellable or commissionable plans. So what brokers am I going to be utilizing? So
yeah, and not only that, you're definitely not hitting that bonus that you thought you were going to hit. Number one, if you do keep your job, what kind of a bonus are you getting? I can't tell you how many, and I'm not vilifying any specific carrier, because as you go across the board, you hear stories from a lot of different sales reps where like the goalposts move all the time and they do or don't get bonuses, and it happens frequently in our industry. But then, you have to also, just start thinking about reorgs again, and
Well, it's also been interesting with the carriers and the national reps of like, everybody wants to think they're better or that they're not as guilty as somebody else. You know what I mean? It's like, well, they did this, and well, we only did this, but these guys did this and this and in these areas. And it's like, well, all the carriers pretty much uniformly across the board, nobody is innocent in the causing some extra chaos this year. I mean, all the carriers, even, the big ones, all had either a lot of SARs to start the year or a lot of non-commissionable plans, and a lot of them, almost most of them, I think Humana is the only one who hasn't come out with some additional suppressed and non-commissionable plans since AEP kicked off.
And devoted.
Yeah, and devoted. And that's really, for us, not to keep beating a dead horse, but it makes it very hard. We were even this morning redeploying lead strategy and buy. And fortunately, we have ecosystems where we can be flexible and we can kind of, tweak the needle a little bit. But we've already deployed dollars and resources and marshaled troops and had lead partners and started our lead gen stuff. And then to always be, it's like you're always trying to hit the moving target.
Well, yeah, you can't. That's the one thing that I would just say as a takeaway, because I know we typically, after AEP's over, we'll have like debrief sessions with our carrier partners and go through, and you have these high level discussions, and then you get like very granular about your goals for AEP, what worked, what didn't, best practices, all that kind of stuff. And that is the one thing. Usually in most AEPs, you do all this where you have these inputs of data and you formulate your strategy and then you're going with it. And this year it's been hard because it's like it's just changing weekly and it is in depth, like to the point with our marketing and how we're doing our lead gen, where our spends are, everything else, where we're having to get so granular with zip codes and counties, and we're having to cross-reference so much data that we can't even just go through that exercise and work and leave it running for a month even. We're having to change it on a weekly based on non-commissionable plans, on a weekly basis. So it's just been, I would say, 10 times the stress and 10 times the work this year as in years in the past.
Yeah. One thing while we're talking about these things, and I hope that people don't think that we're overall negative, and sometimes I listen to our podcast, I'm like, it seems like or people make comments, and we do like to bring attention to challenges in the industry, right? But the reality is I think life's never been better for us.
I'm trying to be smug.
Yeah,
a little bit.
Things are looking very, very great for Agent Boost marketing and for us and for the future. And
be careful, because if you say too much, they're like, they're making too much commission.
Well, I'm talking about our entity, and there's a theory of selection process, right? Where the harder things get over long periods of time, it essentially weeds out the weaker competitors. It weeds out those who are not prepared. And we frankly are seeing that across the industry. And I'm very, very excited about it, because we've gone through a 18 to 2 month difficulty on the Medicare and the ACA side of things, and on the lead gen side, and on the business side of things. And I know for a fact that not everybody is faring as well. But overall, guys, if you are with the right team and you are the right agent and the right caliber, you should be nothing but excited about the way the industry is right now in the future, despite all of these challenges that we may highlight, because we have conversations very frequently about how well things are going for the business, how well we're doing, and how
we're comparing to peers.
Correct. How even our agents that have been with us for years and years and years, I would say most of our agents, including traditional field agents, are up.
They're pretty
production fairly significantly this year.
Our agents are pretty ecstatic. The one I would call out the kind of the two types of organizations or entities as I see who are kind of having a hard go right now is there are some more like clearinghouse style FMOs out there who don't necessarily have any real specific strategic things. They more just, kind of...
They're aggregators.
Yeah,
they've just made money on arbitrage of the contracts.
Yeah, there's entities out there that all they do is function as a clearinghouse to kind of process a contract and give you a writing number, and they have that in masses. And then what kind of happens in that situation is, they don't really have any sort of influence over the products that their agent distribution is writing, and those agents just end up writing whatever products in their marketplace have the best benefits for the consumers in their marketplace. That's what they write. So it flips from one year it's Anthem, next year it's United, next year it's Aetna, it's whatever, have the sexy benefits in the marketplace. They don't really have any ability to have any control over any of their distribution. So I think...
And their revenue margins are slim.
Yeah, and I think some of those organizations are struggling this year. And then the other kind of organization that I would say out there is just that single solo agent, right? In fact, I had a call with 2 different carrier reps this week who told me they're really concerned about the little solo shop broker who, essentially only has the pace to write 50 to 100 apps a year over a 12-month period, and they've accumulated a block of business of 800 or 1,000 clients, and they're in this very highly impactful, area of disruption or SARS, and they don't even possess the ability to service all their members. Like, we just know that those brokers are going to be losing half their books of business.
Correct. Or you have some of these brokers, and we've talked about them before, where they've been very loyal to one carrier in one area, and they have a disproportionate amount of book in an area that this year was either SAR'd or impacted, or their lead plan that they like to write is now a non-commissionable or suppressed plan, and it's making their lives very difficult. And to that point, I've seen a lot of brokers reaching out, and they're kind of tapping out with these field brokers, and they're saying, hey, I want to sell my book of business. I'm done. I'm out. it's been a good run type of thing. I'm riding off into the sunset. And
but here's the thing too. What do you think this year with disruption has done as far as a Medicare Advantage book of business valuation?
Oh, it's nerfed them for sure. I mean,
Right. So the point is, yeah, you might have a broker tapping out right now saying, oh yeah, I'm done. I've got a book of 700 Medicare Advantage and I want to sell them when I'm out. Well, what's going to be the multiple on that Medicare Advantage book of business now?
Yeah, I mean, it's especially, is it DSNP? What carriers is it with? How was it written? There's all these different, variables that go into that to evaluating those books of business.
And even if there's a buyer out there for the book of business, what kind of new products are out there that are even going to be commissionable in that particular marketplace for that book of business?
Yep.
I mean, these are all legitimate things that we kind of talk about because I'm a geek, I'm a nerd, and we talk about it all the time.
Yeah.
But I don't think these are things that your average.
Well, and if you are one of those field agents, your value was you as the agent, your relationship with those clients where, if they needed to change, they were going to call you. You still
Correct.
have clients. You haven't been active in the field for a decade.
I have some 07 active clients.
Yeah, so do I. And I can't do anything to be a bad agent to make them go away. They're just going to stick with me forever. I'm getting texts this morning from some of them, and you become the asset, right? You are the value. And so when you sell that book of business and that relationship isn't there, it doesn't matter how good that new entity or team or agent does to try to reestablish those. They're not the ones that put you on that, and it's hard to rebuild that relationship there.
Yeah, you're kind of starting over from scratch, not completely, but close to it.
So you have to factor that in of like, well, how much, there's no loyalty there to me. So how much am I going to lose just by virtue of, reaching out and saying, hey, so-and-so's no longer your agent. I'm the new guy. Trust me, I'm doing a good job.
Well, think about it this way too with business sales, and there's other industries too and other metrics and components that they do. But, if you're selling like a blue collar business or other things like that, a lot of times it's like 1 times rev, right? Or, a certain small multiple of EBITDA or whatever that may be, that formula for it. And for a Medicare Advantage insurance agent, a lot of times it was anywhere from 1.5 to, the highest you hear is like 2.5 or something like that on multiples of what the
An
value
MA book could be,
Medicare Advantage book of business. Those are very common things that you hear, but you just have to think that with the amount of SARs and service work that overall those LTVs and from an investor perspective, the values, and if you're following, stock prices and earning calls of like the GoHealths and the eHealths and the big brokers, you're having to really look at those LTVs, the CACs, all that. And again, I'm basically just telling all of you out there, if you thought about selling your book of business 2 or 3 years ago and you didn't do it, and now you're saying, okay, I'm tapping out and I want to now, you're not going to get as much now as you would have 2 or 3 or 4 years ago.
I was reading on forums even this morning, and there was a thread about it, and people were like, I'm paying 1 times. I'm paying 1.5 max. Mm-hmm. Somebody's like, if it's a all MA, good carrier, no DSNP, 1.8, but.
Yeah, so my point is, if you're an agent out there and you get $300,000 a year in revenue for your book of business, you may walk away and somebody will buy it for $300,000 to buy your whole book of business.
Yeah, someone's going to be out there commenting like, no, you guys are wrong. I just sold mine for 2.2, blah, 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 blah.
Sure.
But sure, there's outliers out there. But there's a couple, things that we've been talking about the industry overall that play into effect there. There's so many more plans out there. There's so much more disruption and movement every year. Each of these carriers have way more plans filed in. We've talked about these things repeatedly. DSNP, it doesn't stick as well, and there's a lot more competition in the marketplace. All of these things, what is now providing value are the relationships and the machine, the mechanism, the people, the processes, and the organization that are going to keep that revenue in the ecosystem, right? That's what's giving value to a lot of these businesses and entities like ours is they have the machine, they have the ability to keep track of that revenue and keep it in-house, whether or not those plans are moving to one plan or another. And that's what gives value. I
will tell you, just as we're really diving into Medicare and everything else too, you're seeing less of the 11-1, 12-1 effectives too this year. You're seeing more applications loaded into 1-1. And that's because, remember, the election code for DSNPs just went away forever. You know, you can't use the DSNP election code as it was just open.
Well, it had been gone away in Q4 anyway, but
yeah, but now people can't use that as much. And so I would say we've observed fewer 11/1 and 12/1 effective dates, and overall production, more of it's having a start date of January 1st. I've observed that so far. And I also wanted to kind of talk about next year too. And I think that, like we've been mentioning, we are really optimistic and really bullish on our OEP. In fact, we always sell more between January 1st and March 31st than we do as an organization, Agent Boost, more than we do during AEP. And it's interesting because
I hope that's the case.
All of the carriers, they really just gear up and just blow their wad, and they track everything for AEP for their 1/1 enrollments. But the reality is we perform better January, February, March. And we're planning on the same this year, just with as much disruption. We think there's a lot of procrastinators out there still. And again, people don't really want to do anything until it actually very materially affects them. Then they'll do something about it. So I think we're going to have another great Medicare open enrollment OEP in January, February, March. And I also think that we're going to be looking for a ton with the way that the election codes have played out, with it having to be a Heidi or Fighty with that election code. I think we're going to see a ton of chronic enrollments this next year too.
Yeah, tons of opportunity still. As of today, it's basically halftime for AEP, you know, and it'll be interesting for me to see now that the election is over, and people have had their day or two to mourn or be happy, mourn or celebrate, whatever you felt, how if we get a big rebound, because I still think there was a lot of people who mentally were not paying attention to their health insurance and the changes. They were all consumed, you know, by the election cycle. And now we're going to see a massive opportunity for people to pay attention again. And I think we're going to finish this, you know, second half very, very strong.
Yeah. And I would say if we want to move on and start talking about, you know, I guess we can, I'll use the election word because we've already used it once, but, and just how that's going to maybe impact things moving forward. You know, I guess I'll just say it. I think that people, to your point, with the election, people were not as focused about healthcare as they maybe should have been. Like, it's been more of a key issue in years past, but from my observations in talking to very mixed demographics from a lot of people, it was more they were focused on, you know, the economy and inflation, things that really hit and affected their wallet. And of course, healthcare does, and it is a part of it, but it just did not take center stage like it maybe has in the past.
Well, I think as we've seen demographics change in politics, you know, things that were traditionally or historic issues on one side or the other, and healthcare's, you know, traditionally, whether fair or unfair, got pegged to being a Democrat thing, and it was always like, hey, Republicans are against this, you know, or Republicans don't want ACA, they're going to eliminate Medicare. But the reality is, and this is what I want to point out to everybody, is we all want good health care. Right? Like, everybody in America wants good quality, affordable health care. Nobody, Republicans or Democrats, conservatives or liberals, want poor health care. I think when you go back to the origin of the ACA and Obamacare, you know, there was some political resistance to how it would be structured, but nobody, even conservatives, the most conservative people that I know, nobody's like, you know what we should do? Restore those restrictions where insurance companies can deny people for pre-existing conditions or something like that. You know?
That's the one thing that I would tell anybody who is really nervous about, you know, having Trump win the election and being really, I would just say don't buy into the fear mongering yet, because I would just tell you the same thing. Overwhelmingly, when you talk to, you know, whoever on either side of the aisle, there's very good bipartisan support for the ACA. And I know that Republicans would hate to admit it because it was a really big key initiative for the Obama administration and to pass the afford. We're 10 years now. It's been around for a decade. And so to have a key piece of legislation like that be enacted, go through all the growing pains, which it did.
Well, and now there's 24 million people on the ACA.
And to evolve and to get sophisticated and have it functioning and working. And even if, like the Republicans now, they're not going to go in there and just rip the carpet out from under that and then become very unpopular for their voters for the next cycle. I mean, because
it's not 24 million D's or R's, you know, covered under the ACA. It's mixed. 24 million people are getting their insurance that way, right?
Yeah,
it's an evolution.
So I would just say that I don't think that, the subsidies, and I would also even go on the record to say that even though it's looking right now, because they don't have all the House results out yet, but it's looking like it's going to be a supermajority for Republicans where they're going to sweep and have, the presidency, the House, and the Senate. So that means a couple of things. It means that, there's not going to really be a lot of resistance on appointments, especially to those different cabinet positions, just so that people understand, what that really means. But it also, kind of lost my train of thought when I was talking about that.
Well, I think what you were going to talk about is that people were hypothesizing that they were going to leverage the Trump tax credits for an extension of the ACA subsidies, and with a supermajority, they wouldn't have to necessarily capitulate to that.
But I was just going to say that even with the supermajority, I still think if you ask the common American, the enhanced subsidies for health insurance were very popular, and no matter what your political affiliation is, they want to stay in power. And so I just think that it would be extremely unpopular for them to take away those enhanced subsidies. So I personally, this is just Dan's opinion, so I see those enhanced subsidies getting renewed. That's my opinion.
I see them getting renewed with an asterisk. They're going to get renewed with, there are going to be some carve-offs.
Sure.
I do think that there's going to be more maybe income limits that get adjusted. I do think that the ACA being as universally extended to, like the I-9s and things like that.
The I-10s, those are gone.
Immigration statuses and things like that. Those may be not as easy to come by, which...
No, I'll like double into that and double down and say, hey, as far as like the people who were getting subsidies that don't have a Social Security number, the I-10s, those are done. Like those are, but
I was trying to couch it a little softer, but
I'm being really transparent about that, because even before the election, for the last 2 or 3 months, CMS was going to the carriers and actually telling them that. And so that's already been happening for months, where they've been identifying and say, hey, carrier X, you have 500,000 lives without Social Security numbers. Like these, you need to obtain Social Security numbers for these policyholders. Like they've already been pressuring them for like 3 months.
We've already seen that shifting that way.
So regardless of it, let's even just say that the election results were different, that would have still likely gone away, because it's a budgetary thing, it's a money thing. So anyways, those for sure are going to go away. I do agree that there will probably be some curtailing of like income levels and of earners of, they might reduce down if you're a higher income earner, they might curb some of those subsidies that are available. And then I also think that likely we are going to see now some of those Christian health share plans are probably feeling a little bit more safety and comfort now with this administration, in my opinion. And I also think that this is good for STM, the short-term medical, or the junk insurance, as they had labeled it before. I think that with a Trump administration, they're going to allow more of like a free market principle with these insurance products and carriers being able to create the products that they want in the marketplace. That's just, again, these are all just opinions, of what we think is going to kind of happen over the next year.
Yeah, I would agree. I would agree with all of those. And I don't think that there's necessarily going to be a big movement one way or the other. And I think that, the other thing that I think is going to happen, and this is kind of more of an evolutionary thing that we've talked about overall, is we have a problem in this country with too much debt, right? And that's what's causing a lot of the pressures on all of these healthcare products, on Medicare Advantage, on increased costs on everything. And we cannot properly fund, specifically MA, the Medicare Advantage. The carriers asked, for an increase in funding this year, and they didn't get near what they wanted to. And that's been the trickle-down effect is what we're dealing with now. So the problem is that we've talked about on this podcast before is there's not more dollars in the federal budget to go there. We're already spending more money on our debt servicing than we did on Medicare this year, more money on debt servicing than we did on the military. And so we do have to course correct things a little bit. And I do think that, my optimistic view is that we're going to see the economy, the GDP grow, while hopefully seeing a curtailing of costs and maybe a crackdown on some entities. And there is some margin. There's a little bit more spread that could more properly fund these advantage plans and these subsidies without having to continue to feel as extreme financial pressure as we felt this year.
Yeah, I'd agree with that.
The other thing that I think is going to happen, and this is, you talk about the Bobby Kennedy, the RFK Maha movement. I think that regardless of, because of the financial situation that we're in with the country and the carriers and cost of healthcare, I think that we're going to see a movement towards a lowering of cost by actual application of real health principles. And I don't think that it's going to necessarily be all financially motivated or altruistic. It's going to happen out of a necessity. And what I mean by that specifically is you're going to see carriers that are going to start getting creative and going, well, we ain't getting any more money. There's no more money. There's no more funding there. We can't lower these. The only way we can lower costs and make that margin now, because we want to be profitable, is we have to drive utilization down. And so we're going to have to find a way to force less utilization, because we almost had an ass backward effect over the past couple of years since MACRA, where carriers were getting additional funding for unhealthy people, right? And it's one of those, show me your comp plan, I'll show you your behavior. If you're getting funded more for more health exacerbated conditions,
you're going to chase it.
You're going to chase it, and you're going to want to amp those unhealthy conditions up. And frankly, you're not going to really even care that much if you have an unhealthy population or an unhealthy panel, because you're being more compensated for that. So I think what's going to happen in healthcare regardless is you're going to see a shift towards real health-based outcomes, because that's going to be the only way forward that we're going to see margins restoring to the levels that they've been before. So we're going to see carriers starting to accept and adopt, food as medicine. And we're going to see carriers starting to adopt, more principles of, hey, if you're going to the gym or you're doing these other principles that don't cost anything or are low cost, that are going to have a health benefit, which are going to lower chronic illness, lower metabolic health conditions, and overall lower costs, they'll be able to make margin that way. Maybe that's just optimistic, and that's
I think you're digging like way like a few layers deep, like into it very granularly. But I would just say, from like a broader thing, I want to talk about a few things. First is, there was kind of a proposal kicking around out there from the Biden-Harris leadership that had been around for about a year or two, about enhancing Medicare with home care and adding a home care benefit. So I would just tell you that I would imagine that's just dead in the water. Mm-hmm. We're in such a funding environment that we can't even afford to sustain the types of programs that we have right now. And so with that just being the environment, I don't see that getting any legs in my opinion. That's just one thing that I would, really mention out there. And then the other thing is, of course, from a benefit structure too. I mean, we are where we are economically. And so I wouldn't envision plans for 2026 getting better. Even if, there's a little bit healthier reimbursement rate from the carriers, I just wouldn't envision things getting better quite yet for 2026 either. Just because, the carriers are all, like we're seeing, pulling these massive moves right now that they're having to almost, go to mission critical to keep profitable and again, we've talked about it a lot too with these CEOs. I'm trying to not be critical of the CFOs and the CEOs in these different carriers. So trust me, like when I'm talking about the carriers, these are all people that we're a vendor for, mm-hmm. For United Healthcare, for Centene, for Humana, mm-hmm. for who, like they're the supplier, they're our partners, like we're their vendors. And we work for them, and, we're critical sometimes about these decisions that are made, because we're talking about decisions that are short-sighted, when you make plans non-commissionable or suppress them, and the lasting impact. And, we talk about agents keeping receipts, and we don't, the North remembers.
Yeah.
And we will cling to that, and so you think about these long-term lasting impacts, but at the same time, if you're a CEO or CFO and you're in that role and you're like, well, that's great if you're going to hold it against me 3 years from now, but I also have to
worry about my Q1.
I got to worry about like my EPS and hitting like all my targets for like this quarter. And I got to make sure that I don't get kicked off by my board or I don't get fired, at the end of the quarter. And so I have to also keep that in mind when like I'm being critical or thinking about some of the decision making that they're doing. It's the environment of being in a corporate, a big, large, publicly traded company, and the responsibility and obligations that the CEO and CFO have to do now. And they're like, well, I'm going to worry about keeping my job and hitting my financial targets now, and then I'll figure out how to address that 3 years from now with the broker distribution. You know what I mean? So that's another kind of thought that I just wanted to share about all the turbulence right now and the whys and thinking about the outlook.
Well, not only that, but just, I mean, the cycle of benefits and stuff. We know that carriers are already kind of, they know within the first 5 days of AEP how they trended, how they are lying for next year, and that's why they've already made some of these hard decisions to go non-commissionable and suppressed. And they're going to immediately go as soon as AEP ends, and they're going to start working on the plans for 2026. And there's not even a new administration won't even be in effect yet by the time they're already working with what they have. So, the table's already set for the funding environment, like you said, next year. I do think that, maybe they'll build in a little bit more financial optimism one way or the other with what they think the next year or the year after may look like. And maybe they won't have to make decisions that are so short-sighted, like we talked about. But, that is a byproduct of a publicly traded company they've got to, worry about the share price and the earnings and make sure they're being good stewards of the business.
Yeah, these people don't want their heads in a guillotine, at the end of the quarter, right? Which you can kind of understand.
And so, kind of moving on, what else may happen with this? Obviously we're going to see a reshaping of the regulatory environment.
Oh, that's one thing that I will bring up. And I do think that, as we're, and mind you all, like I'm happy like going on, on record and saying like, I more lean, like, I don't think any real American out there who really is into, as a business owner, into politics, anybody really says, yeah, this is my party, and I can go down the party lines and I identify with every single one of their, principles. Most Americans are kind of in the middle somewhere. I identify more with libertarians on average, pretty much. I kind of self-identify as a libertarian. I like the free market principles. That's kind of more my style of everything. So when I'm talking about, policy or what I just want people to understand that I'm not trying to like lean heavily one way or the other. We're just really talking about what we're seeing as a result of the election and where we think that things are going to be headed, right? And so, again, as I look at that, I just know that if we're going to have RFK in his role and like, Trump, I think that there's going to be somewhat of a heavy emphasis to, get the pharma, big pharma. I think there's going to be some, even though there's a huge lobby there, I think there's going to be some very intentional efforts to kind of curb them or get them to pay in more of their, quote, fair share into the healthcare system and ecosystem. I think there's going to be attempts made to kind of go after pharma and especially the vaccine manufacturers.
PBMs as well.
Yeah, like in my opinion, and the PBMs. That's what I think that they will be doing over these next couple of years. Anyways, I think that's just me sharing, what I think they'll be doing. But
well, I also think that, how it affects our industry, we're probably going to see a new administration in CMS.
Cabinet appointee, of course. Yeah,
whether RFK, CMS is under Health and Human Services.
Yep.
And I think that RFK is either going to run HHS or he's going to be a special appointment, and he's going to be able to appoint whoever he wants to run those entities.
Well, there's been talks that he may not be one of those cabinet appointees because he doesn't want to have to answer to anybody, basically.
Yeah. Or he'll have a special appointment. He'll be the czar. He's
Correct.
going to be the health czar, whatever that means. And so I think there's going to be a change. There is going to be a change in administration there. And we have seen, objectively speaking, a very regulatory aggressive CMS this election, this cycle. and I think that we'll see a little bit of a cooling down of the heavy regulatory environment that we've had there. And I think that'll be a little bit of relief for the industry because, we're still reacting to
the last
call letter from the
last 2 years.
And there's still a lot of those things that are yet to be settled. There's still a lot of components that came out during those last 2 call letters that have yet to be fully ingested or take part. And we'll see if those are going to be kind of tossed by the wayside, so to say.
Well, let's even talk about some of the basic things on the compliance with Medicare that some of the agents we know, because we talk to them out in the marketplace. Some agents and agencies are still struggling with actually doing call recordings on their enrollments. Some of them are still struggling with saying the disclaimer that you're supposed to say within the first 60 seconds. Some of them are still forgetting that they have to do scope of appointments because they ran for multiple years without it. And they're like, oh yeah, I got to get a scope of appointment. Like, these are pretty minor and basic things that the broker community at large are still trying to implement to kind of be compliant. You know what I mean? And so that's not even getting into like all those other components of the call letter. And I think the Inflation Reduction Act will probably be revisited or modified, in my opinion.
Specifically, the way that it applies, we call it the Inflation Reduction Act, but it's really the reshaping of the Part D, the Medicare Part D benefit, and how that applies. Because that's been, and to be fair, that's been almost like a fairly positive impact this year for most people because of the decreased cost of their medications. However, just so we're properly accounting for this, that was a can that was kicked down the road till next year through the demonstration process.
Right.
So we've really not even seen how that was going to really truly affect premium prices and deductibles.
That's a ticking time bomb there.
It's a ticking time bomb that now, if it goes unsolved, it's going to look like, the new administration raised prescription drug costs, but really it was a pending thing currently anyway right now that hadn't been resolved. So I think I would love to see some of the nonsensical language that you have to read of like the scopes and the disclaimers and things like that. That stuff's got to be.
Well, and I keep telling people too, like, let's be practical. Pretend like most of these people have not done sales, right? And I always tell them, like, have you ever sat at the kitchen table and tried to explain these things to a consumer, or sat on the phone and tried to be and actually act honestly and with integrity and navigate them through the enrollment process, and have it not feel this awkward thing? I mean, most people don't want that anyway. And I agree. Like my comment has always been like, that disclaimer, if you think that that's important to say, that's great. Add that to the statement of understanding, because you have to go through all those things at the end in the post wrap-up call anyway. You already have to do it. Why make it this intrusive, weird, awkward thing? Just incorporate that as another bullet point to the statement of understanding. You know what I mean? Like, what? That's easy to do.
There are also things that, all these agents, independent agents, any agent that sells has a license, a state accreditation. They already go through background checks. They already are held to fiduciary standards and regulatory standards and fraud, statutes and all these things. They're already held to such a high standard. Agents,
except for the ones that are selling under a principal NPN override.
Yeah, and it's like the ones that are following the rules are great anyway. You want to make sure that they're clearly explaining the benefits to these consumers and that they understand what's happening. All of this overly flowery regulatory language and all of these, reading these ridiculous, pages long disclaimers. I've done that process thousands of times. You've done it many times. Our agents do it all the time. It causes a lot of times even much more confusion and distrust than it engenders, and.
Yep. And when we're on the subject of compliance, again, that's the one thing I kind of just dropped it as a thing, but I would really be in favor and would really like to see CMS or the marketplace really cracking down and essentially going to the carriers and requiring the carriers to crack down on the principal NPN override selling in the marketplace or ACA, because that's again a lot of the fraud, because to your point, that's how agents don't they're not fiduciaries and they're not backgrounded sometimes, and they're not held to the same standards. And you have one person with an NPN and you have 10, 20, 50, 100 agents
with all his
quote,
mules,
agents
with, mules,
with all of those tools and resources, and they're committing fraud or doing things nefariously, and they're not.
And it's not permissible on the Medicare side of things.
But on the ACA side, it still exists, and they should really do something to curb that. So anyways, I think we could kind of really talk.
Yeah, and that's one thing, especially with compliance, is we're not saying wild, wild west, anything goes, but let's have a toning down of like a more common sense approach to making sure we're able to help these beneficiaries, these seniors or these people with their health insurance, and be able to explain it in a way that makes sense, that's not being overly
right.
Regulated. And I think that regardless of who won the election or not, we were already trending that way anyway because of the repealing of the Chevron deference and things like that, and some of the rulings. And, there was a lot of regulatory stuff that was starting to get kind of toned down anyway. But I think this will just help that. And I think overall that's good. And I think that free market principles will attract good quality people and people that want to operate with integrity and get compensated by doing a good job, by helping people. That's what we all want.
Yeah. So I think overall the average agent out there right now listening is pretty beaten down and battered and pretty worn out from everything in the last couple of years. I mean, this is just if someone were saying, hey, what is the psyche and the mental, state of most small agencies and agents out there? I would say most of them are pretty exhausted from the regulation and the sophistication and the advancement of technology and everything that's been implemented in such a short time frame. Most of them are. And so I do think that they need to catch a win, and that I think that there's going to be, at least like to your point, a little bit of curtailing of some of the regulation, over the next year or two. It'll slow down. It won't be such breakneck pace. And I think that we're kind of at this mission critical point where I think that it will start to get incrementally a little bit better for the average broker out there. That's my overall kind of sentiment to kind of bring it home.
Yeah, what I would like to kind of adding on to what you said is I want this industry to be able to attract the best and the brightest talent, to be able, the people that have the most integrity, that want to help people, that are ambitious, that want to do a good job, and that want to be compensated well. The way that the industry has been evolving over the past few years is it hasn't been that beacon of opportunity for a lot of good caliber of agents. And I want it to be that opportunity again, where it's like, hey, you come in, you do a good job, you help a lot of people, you operate with integrity, you're going to get referrals, you're going to make a good living by helping people. That's why we all got into the industry in the very beginning was, hey man, I can make a really good living here if I'm able to help help people with their health and wealth, and I'm able to take something that's very complicated and convoluted and explain it to them in a way that makes sense to them and they trust me. And that's how we win. It's that win-win-win. And I'd like to see it, kind of move the needle, the pendulum swing back that way just a little bit.
Yeah. And the last thing that I would just say too about everything is to kind of, again, wrap it all up, wrap out this episode and bring it on home, is that I think that, regardless of what your political views are, like I said, there was, we even at the company, of course, like with our own agents and employees and staff, we had a lot of people who were really ecstatic about the outcome of the election. We had people in tears beside themselves about the outcome of the election. And that's how it's going. It's very polarizing, right? I mean, politics has been more divisive and polarizing now than ever before. And I don't expect that to change in the future. But what I will say is, look, if you were a very conservative or Republican person, you survived the last 4 years, and if you think about it, we had Obama for 8 years, and we had 4 years of Trump. We had another 4 years of Biden. We've had a lot of, Democratic leadership. If you really look back at the last, 16 years, 12 of those 16 years have been with a Democratic president. And you have to also understand, the balance of power and, executive powers. And now some of those things have been abused, but typically the way that legislation happens and, it's designed to be difficult for a lot of bills to have super majorities and everything. So there are checks and balances in place. And I would just say that, remind everybody that in agent communities and everywhere else, like try to be as tolerant and understanding as possible. We're all going to be just fine. I think that even if you are really upset by the election results, you're not going to see things changing as drastically as you maybe thought. And that I think if you fast forwarded a year or two from now, there's going to be changes, but I don't think they're going to be dramatic enough from a healthcare perspective in our industry. I don't think they're going to be dramatic enough for you to really be that amped up about it. So
yeah, that's very well said. I don't think we need to get in on it any more than that.
Anyways.
Long one. We let's wrap it. Appreciate you guys. See ya.